Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do you use the Aimovig Autoinjector? Aimovig, Mabu, is injected under the skin, subcutaneously, once a month to help prevent migraine headaches. You can learn to give yourself injections at home. It comes as a single dose in a pre-filled autoinjector or syringe. The medicine is injected into your stomach area, abdomen, thigh, or upper arm. An autoinjector is a medical device that typically contains one pre-filled dose of medicine in a spring-loaded syringe. You, or your caregiver, can learn to give this medicine at home. Many patients prefer autoinjectors over single-use syringes as they are easier to use and may cause less worry. Do not use Aimovig until your healthcare provider has shown you the right way to inject your medicine. Before you use the Aimovig autoinjector, read the full instructions for use here, complete with pictures and diagrams of the Aimovig autoinjector. Read about how to prepare for the injection below before you inject the medicine. To use the Aimovig autoinjector, pull the cap off of the autoinjector no more than 5 minutes before you use it. Aimovig is injected into your stomach area at least 2 inches away from your belly button, your thigh or your upper arm, if someone else is injecting. Pinch or stretch the area of skin where you are going to inject. Create an area about 2 inches wide. Place the autoinjector on your skin area at about a 90-degree angle, see diagram. Keep your skin stretched or pinched while injecting. Firmly push the autoinjector down onto skin until the autoinjector stops moving. When you are ready to inject, push the start button on the top of the autoinjector. You will hear a click. Keep pushing down on your skin. Then lift your thumb while still holding the autoinjector on your skin. Your injection could take about 15 seconds. After you remove the autoinjector from your skin, the needle will be automatically covered. If the site is bleeding, press a cotton ball or gauze firmly on the skin. Apply an adhesive bandage, Band-Aid, if needed. When you remove the autoinjector, if the window is not yellow or if it seems like the medicine is still injecting, you may not have received a full dose. Call your healthcare provider immediately. Discard the used autoinjector and the cap in an FDA-approved sharps container. Do not place the autoinjector in the household trash. Amgen, the manufacturer of Aimovig, also has a video on their website that will explain how to inject the medicine. Follow all directions on your prescription label and read the FDA-approved medication guides or instruction sheets. If you do not have an instruction sheet, ask your doctor or pharmacist. How do I prepare for the injection of Aimovig? Do not prepare your Aimovig injection until you are ready to give it. Do not use it if the medicine is cloudy, has changed colors, or has particles in it. Do not shake the autoinjector or syringe. Always check your medicine before you inject it to be sure you have the right medicine, the correct dose and that it is not expired. Do not use the medicine if you drop it, as it may dislodge particles into the solution. Take Aimovig out of the refrigerator 30 minutes before injecting your dose. Do not heat it in water or in the microwave. Other supplies you'll need to gather before you inject Aimovig include alcohol wipes, cotton balls, a Band-Aid, and a disposal container for sharps. Wash your hands with soap and water before you give the injection. Use an alcohol wipe to clean the area you plan to inject and let it dry. Do not inject Aimovig into an area that is tender, bruised, hard, or red. The recommended dosage for Aimovig is 70 mg once monthly. Some patients may benefit from a dosage of 140 mg once monthly. Your healthcare provider will prescribe the correct dose for you. Use only the dose your doctor prescribes. Once you have used the dose, place the autoinjector or syringe in a puncture-proof sharps container. Follow state or local laws about how to dispose of this container. Sharps containers can be purchased online or at retail shops. Keep Aimovig out of the reach of children and pets. You should review the full, detailed instructions for use about the proper way to inject Aimovig each time you use the medicine. If you are not sure how to inject your medicine, or have further questions, contact your doctor, nurse or pharmacist. Related questions: Ubalvi versus Simitrex, Sumatriptan, how do they compare? How often can you take Maxalt? How long does it take for Maxalt to work? How does Aimovig come at the pharmacy? Aimovig comes as a single dose in a pre-filled autoinjector, a device that will make it easier for you to inject your medicine. It is also available in a pre-filled syringe, which you can also use at home. Both the autoinjector and syringe come in the 70 mg or 140 mg strength in a carton that contains one dose. Your doctor, nurse or pharmacist can teach you, or your caregiver, how to inject the medicine at home. How long can Aimovig be left out of the refrigerator? Aimovig should be stored in the refrigerator or in its original carton. However, if you plan to use the medicine within 7 days, you may store the medicine for up to 7 days at room temperature between 68°F to 77°F, 20°C to 25°C. Aimovig must be thrown away after 7 days at room temperature. Do not put the autoinjector back in the refrigerator after it has reached room temperature. Keep it away from heat, light and sunlight. Do not freeze. I have a latex allergy. Can I use Aimovig? If you have an allergy to latex or rubber, you may not be able to use Aimovig. The Aimovig injections devices contain a dry natural rubber, a derivative of latex, which may cause allergic reactions in some people sensitive to latex. Do not use Aimovig if you are allergic to it or any other inactive ingredients, which include acetate, polysorbate 80, and sucrose. Bottom line. The Aimovig autoinjector is a medical device that contains one pre-filled dose of medicine in a spring-loaded syringe. You, or your caregiver, can learn to give this medicine at home. Many patients prefer an autoinjector over a syringe as they are easier to use and may cause less worry. Aimovig, from Amgen, is a medicine used one time per month to help prevent migraine headaches. This is not all the information you need to know about Aimovig, Aimovig, for safe and effective use. Review the full product information, and discuss this information with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.